Hi, I'm Dr. Vikram Arunachalam, psychiatrist with National Mental Health Program of BBMP. World Suicide Prevention Awareness Day is observed annually on September 10 to raise awareness about suicide, its prevention, and to honor those affected by it. The theme for 2024 is Change the Narrative, which aims to break down barriers like stigma, raise awareness, and create a culture of understanding and support to prevent suicide. Everyone, individual, communities, organization, and government has an important role to play in changing the narrative on suicide. So let's understand what is suicide. Suicide is the act of intentionally causing one's own death. It is often the result of an individual's struggle with mental health issues, overwhelming stress, or life circumstances that they feel are insurmountable. So let's understand what are the causes of suicide in India. Among men, financial distress, unemployment, relationship problems, substance abuse, mental health issues like depression, and societal pressure to succeed are leading causes. Among women, domestic violence, dowry related issues, relationship problems, mental health disorders, and societal expectations are primary causes. So, suicide does happen even among elders. So, the commonest reasons being loneliness, chronic illnesses, loss of loved ones, financial insecurity, and depression contribute to the suicide among the elderly. Among children, the academic pressure, bullying, abuse, family conflict, and lack of emotional support are significant causes. So, let's look at the complications of failed suicide or an attempted suicide. So, failed suicide attempts can result in severe physical injuries, including brain damage, organ failure, paralysis, and chronic pain. Additionally, survivors often experience intense feelings of shame, guilt, and mental health issues, including worsening depression and anxiety. So, let's look at the legal consequences of suicide attempt in India. Under Section 309 of the Indian Penal Code, attempting suicide was previously considered a criminal offence. However, with the passing of the Mental Health Care Act 2017, the law now decriminalizes attempted suicide, recognizing it as a cry for help rather than a criminal act. The act mandates that the individual should receive care, treatment, and rehabilitation. So, what is the effect of suicide on the individual and family? Suicide devastates families, leaving them with immense grief, guilt, and trauma. The individual often faces a prolonged mental health struggle before reaching this point. Families may also experience social stigma, financial hardship, and emotional turmoil, sometimes leading to long lasting psychological effects. So, let's look at the warning signs or symptoms of suicide in an individual. Expressing hopelessness, having no reason to live, talking about being a burden onto others, increased use of alcohol or drugs, withdrawal from friends, family, and society, extreme mood swings, giving away prized possessions, drastic changes in behavior like sleep pattern, engaging in risky or self destructive behavior. So, let's look at what is the role of family, friends, and society in preventing suicide. Family and friends regularly should check upon the individuals on their emotional well-being, offer emotional support, listen without judgment, and encourage professional help. Encourage them to seek professional help. So, creating a supportive environment and being aware of warning sign is a crucial step. As a society, let's promote mental health awareness, reduce stigma associated with mental health issue, and provide accessible mental health services. Community programs and support groups can offer a sense of belonging and help. What are the steps taken by Government of India to prevent suicide? So, Government of India started this National Mental Health Program, which is launched to provide mental health services at the primary health care level and increases awareness about mental health issues. Mental Health Care Act, as I said earlier, it decriminalized suicide attempts and aimed at ensuring access to mental health care for all. Tele-Manas Health Helpline, Mental Health Helpline 14416. It's tele-mental health assistance and networking across states. Helpline is an initiative launched by the Government of India to provide accessible mental health services to people across the country. It is part of the broader effort to address the growing mental health crisis and make professional help more readily available in remote areas. It's the digital arm of the National Mental Health Program. Let's look at the key features of Telemanus helpline. It's a 24/7 availability. The helpline is available 24 hours a day, 7 days a week, ensuring that the individual can seek help at any time. There's a pan-India coverage. Telemanus is designed to reach individuals across all states and union territories in India, offering unified platform for mental health assistance. Telemanus provides professional counseling. Mental health professionals helpline connects callers with trained mental health professionals like psychologists, psychiatrists who provide counseling, support and guidance. And the biggest advantage is it's a multi-language support. Recognizing India's linguistic diversity, Telemanus offers services in multiple regional languages, making it accessible to a broader population. And there is a referral system. If there is a need for further addressing the issue, the helpline can refer the individual to the appropriate local mental health facilities through the National Mental Health Register or services for further treatment and support. And the data collected from the patients, the people, or highest level of privacy and confidentiality is maintained. It ensures that all conversations and information shared by the callers are kept confidential, encouraging more people to seek help without fear of stigma. So the government is also creating a lot of awareness campaigns in liaison with NGOs, non-governmental organizations regularly. They conduct awareness campaigns about mental health issue, about drug use, about suicide prevention in schools, colleges and workplaces, also at urban slums. So these efforts combined with societal involvement aim to reduce the incidence of suicide and provide support to those in need. Thank you.